introduction, just introducing who you are, just so everybody's familiar with your faces on the call.
Sure. Hi, everyone. Thank you, Tracy, for another great discussion. My name is Dr. Lucette, and there's a history of cancer in my family, so it's pretty close to home. So that's something I feel passionate about, and that's also why I do what I do as a psychologist. I help women and men as well deal with cancer and other illnesses, so that everyone doesn't have to feel alone ever again. So I really enjoy those talks and happy and looking forward to this one as well. Thank you, Tracy.
Thank you for joining. Wendy?
Hi, my name is Wendy. I'm from Chicago, Illinois. About 3 months ago, I found out that I had cancer. I have the BRCA1 gene. I made a decision to do a double mastectomy, and at that point also decided to do a deep flap. I had been given, obviously, we all have been given a lot of choices, and that was the right choice for me. So I'm just recovering right now. This is a pretty bad, you know what I mean, compared to like saying having a total knee replacement. This is some pain, but I'm going to get through it. I'm going to be, you know, cancer free and be able to be there with my family, and, you know, and that's all that matters right now to me. So,
Thank you for joining.
Yeah, thank you for having this awesome Zoom meeting organization. You have no idea how much I appreciate it.
Anything we can do to make a difference.
Thank you.
Diana?
Ductal carcinoma, and I had surgery and I have not started. I'm supposed to start radiation sometime around the end of October.
Thank you for joining. Kate?
Hi, everyone. I'm Kate, BRCA2. Found Tracy when I started my BRCA journey. Had direct to implant surgery at Sylvester, and that was February 4th, 2019, and I'm on the board, so if anyone needs anything, just reach out to me.
Thank you, Kate. Mary?
Hi, sorry that I was feeding the little man. That's why I had the camera up.
Okay.
I'm Mary. I was diagnosed with breast cancer in February 2019. I met Tracy and the BRCA Strong crew in December of 2019. And unfortunately, like I say in every meeting, unfortunately, I was hit with a big C, but I'm glad that because of it, I was able to meet all these women. And even though we are going through the same, I guess, ordeal, everybody's story is different and we all learn from each other, and it's great. Thank you.
Thank you, Mary. Leslie?
Hi, everyone. I'm Leslie Flores. I was diagnosed in January of this year. Initially, I had gone somewhere and the machine kept on breaking, and I asked a coworker, oh, can you refer me to a place? They referred me to a place in Boca. I went there, had a pathology report, came back saying, you're stage 0, no chemo, no radiation, you're good to go. However, due to the mass, it was so large, calcifications, you need to have your breast removed. I had my left breast removed in April, came back saying I did in fact have cancer, which threw me off the loop. Stage 3B. I was introduced to Tracy by a mutual friend, and Tracy introduced me to my oncologist and to my chemo nurse, and I'm so thankful. Just finished my chemo September the 18th, and I'm waiting to meet up with my radiologist next Tuesday, and we'll decide, or I guess we'll speak about my radiation, which will be 5 or 6 weeks. And then I'm continuing with my target therapy. Hi, Mayra. Thank you.
Thank you, Leslie. Good to hear your voice.
Thank you.
What I'd like to do next is Kate introduced herself as one of our board members, and Tammy has joined us, who's another one of our board members. Tammy, you want to go ahead and introduce yourself? We're just doing short introductions.
Sure. I'm so sorry. I got distracted, people next door, whatever. So I'm here. Good afternoon or good evening, everybody. I'm Tammy Aon. Like Tracy said, I am a member of the BRCA board. I am BRCA1 positive and a 2-time ovarian cancer survivor. I had the latissimus dorsi flap after my double mastectomy. So I'm really grateful to Tracy and everything that she does, and excited to see you all here tonight.
Perfect. Thank you, everybody, for taking the time to come on tonight. We're going to go ahead and start. I'm going to mute everybody. So good evening, everybody. Thank you for joining. I'm Tracy Milgram-Posner, the founder of BRCA Strong, where we empower, educate, support, and advocate purvivors, survivors, and thrivers to eliminate the feeling of isolation and help you feel whole again. What BRCA Strong's mission is to fund women post-mastectomy garments, lymphedema sleeves, and pillows. If you are a family member in need, please feel free to reach out to myself, Kate, or Tammy on the call, so we can go ahead and provide them the proper garments that they need. As I know, these garments have made a huge change in my life personally, as going through the journey of taking preventative action. I didn't know that there was prosthesis and bras for after having a mastectomy, as I was told I was not able to wear underwire. So this has brought a whole new life to me, and I want to bring it to all the women that are surrounded by me in our community. I know normally when it's not COVID-19, we're doing transformational photo shoots, fashion shows, medical panels, women's get-togethers. So during COVID-19, we're sending out packages to family members and friends for support to give them information on breast cancer, on genetic testing. So if you or your family member need any of that information, you can feel free to reach out to us. And tonight we have Mayra Lima and coming on tonight to educate us on survivorship, life during and after breast cancer, where a lot of us get released from clinics or treatments and are so lost and confused. To me, this is a program that I look forward to hearing on, because so many of our girls come to us and say, you know, well, I was dismissed from treatment, what's next? So this information tonight will guide us, and Mayra's going to share her story and give us some information. So thank you so much for your time and dedication. I truly appreciate you coming on.
So thank you so much for allowing me to be part of the program and the education, and also any other support that I can be of, whether you're one of our patients or not. Just keep my information, and whenever you need any questions answered or anything, so you know, sometimes just talking that helps. So tonight we're going to discuss the importance of recognizing that you are a survivor from the moment you get diagnosed, and we'll go into that a little bit. After diagnosis of breast cancer, during treatment, and thereafter. So you could be 100 years old and had cancer when you were 50, and you're still a survivor of breast cancer. So it's sort of, I see it like belonging to a group, okay, that a sisterhood. You don't divorce your sisters, you don't, you know, disconnect. So we're always going to be survivors until we're dead, you know, whether we get hit by a car or we die from the breast cancer, right? So that's important. And then we're going to talk about what does that mean. Describe the areas of cancer survivorship that are impacted by the treatment. You know, I do an awesome, I think, chemotherapy teaching when the patients are going to start, you know, treatment. And the reason I do that is it's sort of like overwhelming. I know that it's very large, but most of the people know exactly what is coming and what to do about it. And we're going to identify challenges all along the process of surviving. And let me see, what is my, here's my next slide, I think. There we go. There we go. So an individual is considered a cancer survivor at the time of diagnosis and through the balance of their life. Family members, this is one part that we don't always think about, you know, but family members, caregivers, you know, partners, whatever, those people that love us are also impacted by this survivorship. And they are included in this definition. I like this. I found this. Can you see it? I don't know if you can see it because I don't know from your end what you're able to see. I think that you can see the slide. You can see the slide? So I like this quote. I pity the fool who just gives up. We're all going to die eventually from something or other, but don't be a wimp. Put up a good fight. Don't sit down and wait around for death. We can be tough. We can be determined. Go out and have fun and make death find you. We can be living with cancer, not dying from it. And we can be cancer survivors. Don't you think that's very powerful? And I was really, really surprised when I saw who wrote that. That was Mr. T. I think I never would have thought of him as sort of like a philosopher having this very deep thought and idea. And I think it is just amazing. It says it all. So the magnitude of this, we have 3.8 million women with a history of breast cancer alive as of January 2019. You know, the SEER data and the data from the American Cancer Society, it's 1 year behind, right? So this is like a year and a little bit more, but doesn't matter. It's amazing, right? So it's hopeful, it's hope, and hope is very important. There are more than 150,000 women living with metastatic breast cancer. That's also amazing. And I know you alluded to that previously, that in fact, you know, people discard you. Oh, okay, you have now the cancer in the liver. Oh, you have now the cancer in the bones. That doesn't mean anything. You could live with that for 20 years. You can live with that for more. You can die again of a car accident, not necessarily from your cancer. And that's what's important to me. So as of January 2016, there was 15.5 million cancer survivors. And I highlighted the second paragraph, which is the number of survivors is to increase by 31%, or almost 20 million by 2026. That's huge. That's huge. That's, you know, we have to be grateful. In fact, if you're going to be grateful, there's a lot of things to be grateful about cancer in general. And that's a philosophy that only comes after you've had cancer, okay? But it's the time right now of being a person diagnosed with cancer cannot be any better, because we have so many treatments and so, you know, so much, we're doing so much better than we ever did as far as surviving and quality of life. So the death rate, I put this slide here, even though this whole thing is redundant, I've said it 20 million times by now, you know, 3 slides talking about how we're doing so much better now. The death rate dropped by 40% from 1989 to 2016. I don't know what it is right now. It probably dropped some more. And so that brings me up to survivorship, and how do we look at this from a medical perspective? So the stage number 1 is the time when you're diagnosed, it's the acute phase. Stage number 2 is the transitional phase. You're moving from treatment, from active treatment to careful observation. Stage number 3 is extended watchful or survivorship, and that is just a follow-up. So we follow you up. You know, a lot of people, let's say that after 5 years, we happen to find a bone lesion. And I said, well, that's why we're following you. That's the reason why you come to us. Otherwise, we would have dismissed you after you finish the first, you know, treatment, you know, chemo, this and that. You finish your pills, and then we never have to see you again. We continue seeing our patients as long as they need to. And there is a separation anxiety, you know, at 1 year, Most people, we tell them, yeah, after 5 years, we tell them, okay, you can come once a year. Most people don't want to. I was one of those. I continue seeing my doctor every 6 months, despite having changed insurance and having no money to pay him. But I did because I had a separation anxiety fear. Stage number 4 is when you have a permanent survivorship. And, you know, that's a loose definition because, like I said, we're alive, we're surviving. You could be hit by a car, right? Let's go to the next slide. So, as survivors, we have unmet needs. They're physical, they're spiritual, they're psychosocial. They require navigation, coordination of care through a very complex system. We, like Tracy was talking before, we do have to be our own advocate, you know, so it's complex. And they also have significant long-term side effects that have to do with the type of cancer, that have to do with the treatment, and with medical conditions that we get as we age, right? So what about life after diagnosis? It really starts with the diagnosis, right? When you are told you have cancer, it is always unexpected, even in persons whose disease is very obvious. I've had people, I'll never forget, I had a patient whose tumor was the size of a football, And she didn't really realize that this was cancer. She had no clue. So when we told her, you know, she wasn't shocked. She came to us with a hemoglobin of 6 because a tumor that's the size of a football is going to need nourishment, and it takes the nourishment from you. So we had to give her transfusion immediately, and anyway, she did really, really good. So you go, as a patient, you go into a shock mode. You don't ever expect it, number one. Some of us with reason not to expect it, good life, no smoking, no drinking, no excessive anything, no McDonald's every day. You know what I'm saying? You don't, no extreme family member, no genetic mutation that you know of. So it's really always unexpected again, and you do go into a daze and you're asking yourself, is this real? I like to tell this story because it brings it down to the humanity of it. So I was a nurse practitioner when I got diagnosed. I did GI cancers, and I don't like to pat myself in the shoulder, but I care a lot about people and my patients. I went into nursing just because of that. And I enjoy my life and my work, my professional life and my work very, very much. And when I got the diagnosis, I said to myself, well, or to God, whoever you believe in, and I said, why me? And then, so I went into the pity mode and crying and depressed and whatever. And then I said to myself, okay, at the time I got diagnosed, 1 in 7 women was being diagnosed with breast cancer. Today is 1 in 8, by the way. I'm sure you guys have heard that before. So I said to myself, okay, what makes me different from any other women of those 7 that are around there? I'm a woman, I have breasts, nothing. Nobody cares about how good you are, how bad you are. It just happened. So I slapped myself and I said, you know, you just have to move forward. There's nothing you can do right now. You have it, and you want to be around for your child and your children, and you want to be, or you want to die. One of the two. You want to jump out of a building? No, I did not. So you move forward. And that's what we have to continue doing throughout life in general, because the same way we have this challenge of cancer, there's 20 million other challenges that you're facing every day, right? So other considerations that some women have, okay, how about fertility? I have, women that have never had any children. How about work hours, FMLA, family issues? Who will pick up the children, grandchildren? Who will take care of the elderly in the family? Who will provide for the family? Because a lot of times we're single mothers, right? So there's so much to take into consideration. And you are absolutely right, Tracy. Knowledge is power, whether you think it is or not. I was sharing with Tracy how sometimes I think, oh my God, I should not know this much, but it is power, and I'd rather know than not. Okay. And then when you know what is there, then you know what that you have to move forward. One of the things that happens a lot of times, and I've seen it in a lot of people, is you're not happy with something, whether it is your job, whether it is your marriage, whether it is any type of situation that you're going through. Life is short. When you get hit with cancer, remember I told you I thought that it was a blessing in disguise? You get hit with cancer, you say, no, it's not worth it for me to come to work every day and be bitter and be stressed and be, unrecognized, whatever the situation might be. So, or the husband, beats you up every day. What are you going to do? Or not beats you up, but perhaps doesn't treat you appropriately. You gotta correct that. You gotta take care of that first, because then that will help you move on to your healing. And you have to find a passion in your life. What are you passionate about? When I got diagnosed, I said, okay, do I change careers? Because once again, I know too much. Do I change path? I used to do GI. And if I move to something like breast, am I going to be satisfied? Am I going to be happy? Because GI is a whole slew of organs and a whole slew of treatments, right? So I did decide to move into breast, because in the end, I said, I really need to help people if I'm going through this, whether it's going to be sad or happy, I don't care. I just need to be able to know that I'm helping people. A lot of times, and I'm not saying that, but a lot of people think, okay, let's go all crazy and let's start drinking alcohol and trying to drain that fear into, or channel it into something else that might not be healthy. And drinking is not. So moderation, and weigh the risk and benefits of whatever it is you're deciding to do to move forward. So the impact of treatment, what about that? It can be physical, it can be psychosocial, and it can be, as we all know, financial. And this is a conversation that I have every single day with someone. And especially now with this COVID pandemic that hit us blindly in the gut, So this is a big issue. I was just talking with a patient today who we were talking about the labs, and the labs are being sent to the correct place and stuff. And he said, but they send me to collections. And I said, why? I'm sending it to the right lab. So apparently at some point they ran the lab in instead of sending it to his preferred lab by the insurance, and he's in collection. That's really sad, really sad. So what about the type of effects we can have? We can have long-term effects from the treatment, and we can have late effects. The long-term effects are things that happen not necessarily at the time you're going through the chemo. chemo-brain, fatigue, have flashes, sexual dysfunction, anemia. You know about the white blood cells being low, skin sensitivity, lymphedema, xerostomia means dry mouth, incontinence sometimes, pain, yes, late effects, cardiovascular disease. You can have this 20, 30 years later. It doesn't have to happen a year later. It usually is late. Metabolic syndrome, yes, I have that. And some people already come with some of these, by the way, so they have it as a baseline. Venous thromboembolism, osteoporosis, leukemia, myelodysplastic syndrome, cataracts, lymphedema, sexual dysfunction, intestinal problems, secondary primary cancers. They might be related to the chemo, or they may just be part of your, in the case of the BRCA, part of that syndrome. Neuropathy. Neuropathy can be actually, it can be in both sides, you know, short-term and long-term. One of the things that happens, and Dr. Lucette can attest to that, is depression or depressive symptom, distress, worry, anxiety. Forever you will be fearing that the cancer might come back, forever. Whether your toe hurts, you have an ingrown nail, and you have to work mentally against those thoughts. There's just no two ways about it. So the fear of recurrence is there. In I can tell you that in my lifetime, I've had a lot of issues, a lot of problems and whatever, but I never felt fear the way I felt fear at the time I was diagnosed. It's like it took over me. And the doctor that was my oncologist, I was shaking. I mean, for nothing, you know, and he said to me, I asked him, and he said to me, well, what do you expect? You've been hit with a bazooka, not with a regular gun. I said, I'll take that. It's true. I think so. So we're going to talk a lot about changes in sexual function and or desire. Well, that comes up all the time because it is a big issue for women. And body image, self-image, relationship and social role difficulties and concerns about work, and again, financial challenges. And I'll wait for you guys to ask me questions so that we can talk some more. But in breast, it's estimated that 17 to 11, and that anxiety and depression is 17.9% and 11.6% respectively among the general cancer population. And in a study, they found that the depression and anxiety, specifically among breast cancer, was 22%, and the rate was between 13 and 56%. So the risk of having a major depression after diagnosis of breast cancer was higher among younger patients and patients with a history of having been depressed before, and patients with low socioeconomic status, and those who were unemployed. Because why? They have 20 million stressors. Now you add the breast cancer on top of that. Are you surprised? I'm not. Body image is the way a person feels about themselves, their bodies. And there is evidence that for cancer patients, this is a challenge that some people overcome easily. And I do not like that because I don't think it's easy for anybody, to be honest with you. There's just some people that cope with it a little, they have better coping mechanisms with this, and mentally they're able to move forward easier, but I don't think it's easy for anybody. In breast cancer, 31 to 67% are affected with this because we have things such as hair loss, surgical scars, loss of a breast, even if temporary, even if you're going to go back to having more plastic surgery, the lymphedema, sexual dysfunction, chemotherapy-related early menopause, skin changes, post-radiation, weight gain. I can swear to you that I think my mom became Alzheimer's diagnosed at the time she was going through menopausal changes. I think that the hormones are very, very important for our brain and our well-being. And on the other hand, they're also highly regarded by breast cancer that's hormone sensitive. So we have to weigh the balances, take one or the other, and do the best we can. Patients also have radiation-associated breast soft tissue fibrosis. They have, and there is something called oral pentosyphylline and vitamin E that can, it seems that is helpful. So you're free to ask your plastic surgeons or anything about that if it might help, especially if you've had radiation. Breast reconstructive surgery, most people are not happy. No matter how many times they go through surgery, they always find some nitpicking about them. And we've seen some great surgeries and we've seen some not so great surgeries. So, but just know, you know, I mean, have some, you can have some empathy in that even if they had the best surgery, the less complications in the world, they may not still be happy with it. For women with early menopause and sexual concerns, the answer is support groups, psychotherapy, cognitive behavioral therapy, couple-based interventions, and sex therapy. Now I'm going to mention those more. The studies show that the one-on-one psychotherapy seems to be the most effective, the best of all of those, but all of those can be used. How about CHEMO-BRAIL? What does that manifest like? Everybody has it in a different way. I think I had it very much in a way that is affected my speech and my thinking. So I was thinking of the word chemo, but the word chemo would not come out of my mouth. It would, and even to, I think I still have a little bit, to even in today's day and age, I'm 16 years post treatment and diagnosis. And I think I still have a little bit of that. I don't know. I might be getting old anyway, so. Difficulty concentrating, difficulty finding the right word, difficulty learning new skills, difficulty multitasking, taking longer than usual to complete tasks, trouble with verbal memory, such as remembering a conversation, and up to 75% of patients in treatment and 35% after treatment report these symptoms. So it is very common. It is not a rare side effect. So they don't really know the cause. So we don't really know. It cannot, some people have it after surgery alone. They never got chemo. So they get diagnosed with breast cancer, they have surgery, they have radiation, and there's really no chemical reason for it. So you want to see a neuropsychology for assessment and referral to cognitive rehabilitation as soon as possible. Exercise, so someone there said someone was told to stay in bed. No, exercise, I mean, you need a balance depending on how you're feeling and where you are in the game. Have a balance of rest periods with active periods, okay? Whatever that might be. Crossword puzzles, stress relief, stay organized. That's a big problem for me. I'm not organized. I never was. I think I'm probably allergic to organization, the way I live my life. No distractions. Try, if you're doing something that you need to do Try not to have any distractions in the way, and take frequent breaks. Exercise the body. That helps with the circulation going through your body. Fatigue is big, and it's about 28 to 91% of cancer survivors reported. It may last a long time. A lot of people tell me, but when is this going to go away? Whether it's neuropathy, fatigue, or whatever, it doesn't go away immediately. It takes a long time. It's a process. So sleep is very important, and a lot of times, whether we have pain, whether we have other family issues, we have little ones that you're thinking about, or something else, sleep eludes us a lot of times. So the category 1 recommendation means that this is what they have studied and what all the studies show that works. And this is a meta-analysis of 3,000 people. Cancer survivors showed that moderate intense resistance exercise reduce fatigue. There is no, the psychostimulants really have a lot of side effects, and I don't recommend them because you don't want to end up with another problem. Cardiac toxicity usually is a combination of chemotherapy, anthracyclines, targeted therapies, hormonal therapies, radiation can all cause that. And it's less than 5% though, the incidence. However, because it is something that is so important, like the heart, we pay a lot of attention. And we do most of the time, for whether it's anthracycline, targeted or hormonals or radiation, it can be reversed, and they have ACE inhibitors and beta blockers, and again, healthy living that help with this. Again, sexual function. Complaints are very common among cancer and among breast cancer patients. They do have a tool for women, but not for men. It's called Female Sexual Function Index, which is like a questionnaire, and it tells us where you are in the game and what to do. Usually this is something that your psychologist can give you. Your oncologist will have no time and or desire to spend their time doing this test on you. But when you have a psychologist, they will take care of you. And again, it's multifactorial. It's not one thing. I've always said that when you get cancer, this is either going to make you stronger as a family unit or member or unit, you know. I don't like to right now. It's so different. It doesn't matter if it is a heterosexual man and women, men and men, whatever it is. Cancer is a stressor in a relationship, so it's either going to make that couple stronger or weaken the relationship. And when it makes it stronger, it's very beautiful. When it weakens it and there is a weak link, I love the Fockers, you can tell, right? When there's a weak link in the relationship, it's not funny. But in the end, I always like to look at the positive. That's what I love about Dr. Koffa. She's a lot more positive than I am. She'll turn it all around. In the end, it's all good. Why? Because you're getting rid of someone who really didn't belong there, you know? So support groups, psychotherapy, cognitive therapy, couple-based therapy, sex therapy. Lymphedema. Lymphedema is a challenge. Over 40% of cancer survivors, and I'm not talking about breast alone, will have lymphedema. When you have GI, they do remove at least 12, if you have colon cancer, they have to remove at least 12 lymph nodes in order to really stage you, okay? So they have stages. When you go to see them, the earlier you start the process of seeing someone for lymphedema, the better it is. And the physical therapy, again, helps a lot. encouraging a healthy lifestyle. The biggest, by the way, and I don't know if you guys know this or not, but the biggest contributor to lymphedema is weight gain. So trying to maintain a healthy weight by exercising, following a diet high in vegetables and fruit and whole grains is very, very important. And we can always, connect you with a wonderful nutritionist, whether in whichever facility you're at. Most of them have it because they understand that nutrition is so important to survivorship. Spirituality may help. We do notice that they have improved quality of life when they believe in something or someone, increase one's will to live, and improve coping skills. They also improve stress and pain management, believe it or not. So it's very important. Once again, I've already said this many times, but the most important thing, and I don't think I've said it, is to communicate with your partner your feelings of what's happening, And Dr. Kafam, she's great, like I said, all around oncologist because she addresses all of these things, and not a lot of people do. But you have to work at this. This is not anything that will be magically getting fixed. You have to talk with your partner, and you have to talk with your medical providers about it. A lot of times this is not brought on by us, it's brought on by the patient to us, and because of the time constraints in a visit. So cancer rehabilitation, it's so important. Again, you want to assess what chronic issues you have. We have to try to mitigate them, and what other pre-existing issues you have. A lot of times, I just had one patient, and I like to use cases because they're so, they bring it to the light, who doesn't have cancer, okay, at all. Her doctor sent her to us. We were just following, once every 6 months for the breast because she has high risk. She's a high risk patient because she's had back pain for 6 months. Do you think that's a good, family provider? No. I order an MRI. The insurance said to me, why are you ordering an MRI? The lady doesn't have cancer. I said, you cannot ignore what the patient tells you. If she has back pain, we have to take care of it, right? So that's the thing. And the whole thing is, again, you have to recognize that we are survivors, that we want to have the best quality of life, and we got to find that way. And again, you have to be your own advocate in this case, because for all I know, you're a happy camper. So not everybody knows about it, and you need to work on this. The ASCO Cancer Survivorship has a lot of information. They also have information on adolescent and young adults. We have people that are very, very young in our setting. We've always had a young, what I thought to me was a young practice. When I got diagnosed, I knew a lot about GI, but not about breast at all. So I thought I was young. I was 50 when I got diagnosed. So when I went into working and I saw people in their 20s, in their 30s, in their 40s, that's when I realized, what young is. And we've had this group of people, of doctors, of providers, have always had and taken care of young women with breast cancer, and men. We do have men too. Very few, but you know, again, when you have a good practice, people are attracted, they hear about it, and they do take very good care of the men too. So the communication with us is super important because we don't really know unless you tell us. So surviving is the name of the game. The name of the game is having a good quality of life, surviving, and being the best that you can be. So I have a true survivorship story. Rita Sopinski is a cancer survivor who developed a love of art after she battled with cancer. She was not happy in her work. She got rid of that. She learned, she had never picked up a brush in her life, she told me. And she went to Gilda's Club and learned how to do watercolor. And I don't know about you, but all I want is to win the lotto so I can commission her to do some photos, you know, some pictures for me, because I love them. Look at the color. Look at these other ones. Every time I see something of hers, I fall in love. She gave me permission to use them. Actually, she sent them to me. She's being awarded in the state of Florida. I don't know if national awards do. I'm pretty sure she has, because look at this. They're really awesome. Awesome. She, I was looking at the floor in this picture here on the bottom. It's so shiny. I don't know how she achieves this work. I don't know. But, you know, I would love to know, because I'm an admirer of art, but I don't know how to do it. But it's beautiful. She is on Facebook. I don't know if she is on Twitter. Look at this one. It's almost like you can touch these plants, right? I like this baby too. Look at him and the book he's seeing and how she's drawn it upside down. I mean, I'm just thrilled by it. And so I can tell you that once I got diagnosed, even though I'm getting back to my old habit of eating a lot of meat, I did change a little bit. I have more vegetables. I have my daughters. My son-in-law is a athlete, and so he does a lot of marathons and all kinds of different sports. So we were watching one of his marathons, and my daughter was doing it too in Disney. And I saw a gentleman that was in crutches. And I really felt ashamed that I was sitting on the sides. And so started the first marathon I did. Anybody here in this group lives in Weston? No. Thank you, Lord. I hate Weston. And I will tell you why. I will tell you why. This is going to be funny. The first half marathon I did was in Weston. They have them in December. They close the streets. It's really a lot of fun. Well, I was the last one coming in, and they took down the tent. They didn't have water for me. They didn't have any food, and I was dying. So it was very nasty. After that, I did Disney, and Disney is unbelievable. And I was going to share with you, my last marathon was last year. We went to Paris, Disneyland, and we did the Disney marathon in Paris. And that was an awesome trip. Awesome. And you can see me when I passed that red thing, that the finish line. I was just like, I could not believe that I finished, because I did not really train for that. And if you all want to find out, an amazing group of trainers in Hollywood Beach. They are great. They train on Saturdays, and I highly, highly recommend it. The other thing I highly recommend, but I have never done it because I don't know how to swim and I'm afraid of the water, is I can't remember their name now, but it's a rowing group, and they meet. Yeah, do you know them?
Yeah.
Wonderful.
Our word, fierce fighters.
Yeah, the fierce fighters. I love them. I just can't do it. I want to, and I don't know. I might surprise myself one year, and do it. But I don't know how to swim, and I'm afraid that that thing is gonna go like that, and I'll drown. That's my biggest fear is dying by drowning. Not cancer, but drowning.
Teach how to swim. That's it.
So I'm sure you guys have a lot of questions or not. Tell me what you think.
So what I want to do is let's open up. I can either unmute everybody. I'll unmute everybody.
However you want to do it is fine.
Does anybody have any questions? Any questions? Go ahead.
Yeah, thank you for this wonderful presentation, Mayra, and congratulations on running those marathons. I'm really I'm impressed. I was wondering, I mean, with COVID, we know that anxiety is through the roof. I'm wondering if you're also seeing that in the patients that you're seeing in the office in terms of the severity, not only of their mental health symptoms, but also their side effects, like, yeah, everything, like even physical side effects. Oh, I think you're muted.
Oh, hold on. Go ahead.
Oh, I can hear you now.
So I don't think I'm seeing increased side effects, but we are seeing, for example, we have a patient that did not get her biopsy because she got COVID. So there was a delay in that diagnosis, right? Yeah. And not a humongous delay, but I can talk about my daughter because she's put it on Facebook, but we've been following, Dr. Kaffa has been following her. She has a great high risk clinic. So we were, I connected my adult daughters with Dr. Kaffa right away. Years ago, she had atypia, and then she's been having the MRI and mammo, and then all of a sudden, skip couple of years when we, moved to UN Plantation. And then I insisted, hey, did you get it? Did you get it? Did you get it? You know how a mom is. And in fact, it was cancer. She had something that needed a biopsy. This was found in January. She had the MRI in March. Then the biopsy was positive and she could not get surgery or treatment. I mean, they put her on tamoxifen in the time being because it was DCIS, but she ended up not having the surgery until the end of May, the third week in May. Luckily, it stayed DCIS. But on a personal note, I can.
That's stressful. Yeah.
There's so much.
Yeah.
It is, and if you want to talk about anxiety and you want to talk about someone almost going crazy and crying every day, that was me. She was fine. It was me.
Yeah, no, I'm sorry you went through that. And you mentioned kind of that.
What I do for a living. Remember I told you that that's a problem with knowing too much. It's what I do for a living. So so I was so fearful. And luckily it wasn't. Now we'll see what happens. We'll keep on praying that everything's
Best wishes to her. Yeah. Thank you for sharing.
But yes, we are seeing a lot of anxiety. We're seeing, I had one of my best friends, she was diagnosed with DCIS. She went for surgery and they found, like Leslie, I don't know if she's still on, they found that it was invasive, that she had invasive. And not only was it invasive, but she had HER2 positive. Totally a big blow. And then during the pandemic, she said, is it worth it for me to continue my treatment? And we, again, were very nourished and we said, well, do you think that cancer is not going to come back or stop growing? If we don't treat you, that's going to be what's going to take over. So, and actually, I do feel that as far as as far as safety is concerned, you're probably safer coming to our place than you are going to Publix, let's say. You know, because we're taking your temperature. You cannot walk in except if they ask you 20 million questions. I was just reading for us, the employees that and providers, that we're going to have to do a questionnaire before we walk into the building every day.
Wow.
Yeah, wow, it's right. Can you imagine every day, one more thing put on our shoulders? I mean, it's
It's a lot.
it's not fun. But what I'm saying is it all comes back to, and if you answer to any of those questions and you have a sore throat, you don't feel well, go back home.
Yeah.
Go back home. That's what you got to do. So I think that as far as safety is concerned, it is safer to come and get your treatment than not.
It's so interesting that you say, you know, like it's safer now, but yet there's been increases in so many new cases because people are delaying their coming in and getting their screenings. You know, we had a call last week and I think it's like up to 44% of like people are just not doing screenings and stuff due to COVID-19. Like tomorrow night we have Dr. Perez coming on to talk about it because people are just pushing their screenings off.
When is she going to talk?
Dr. Perez is tomorrow at 6, and then Dr. Kalfa is next Wednesday at 6.
Okay. Maggie, make sure you hook me up and don't let me forget.
Absolutely.
I definitely want to hear it. No, it's true. And, you know, it's really a challenge, and we got to work with that every single day. Every single day we have to work on that.
You know, like coming up, like even genetic testing, we had somebody speak and they said like people aren't even doing genetic testing, or they're going through a company that doesn't offer genetic counseling. So now they get these results and they're overwhelmed and they're anxious and there's nowhere for them to go.
Well, wait, most insurances have to have genetic counseling. And then you can go outside of that company. Let's say that is Timbuktu. And Timbuktu provider did a genetic test on you because the surgeon said, I'm not going to touch that lady with a, you know, with a family history or with the Ashkenazi background, which, you know, there's founder genes in the Bahamas, there's founder genes in Mexico, there's founder genes other than the Ashkenazi, by the way, just so that you know, of the BRCA, you know, 1 and 2. So different founder genes. But anyway, what you can do is you say, okay, let me check who is a genetic counselor in the neighborhood, who has it. Like, let's say Cleveland Clinic, Memorial, all of these places do have it, you know, and you can just, you don't have to leave that provider. You love them, you're in love with them. They're good providers, except they don't have a genetic counselor. You have to get the information for you because their implication is so vast, you know, with this gene being mutated. It's not just the breast cancer that's an issue, but other things too.
Does anybody else have any questions? Nope. Perfect. Mayra, thank you so much for coming on and sharing your personal story along with your family and giving just such insight on survivorship. I know, like I said, there's such a lack of it for other women. So to educate them and let them know that there are options, you know, just sharing your facility alone and what others can implement or come to your facility and know the services are available. I know that Maggie, you, Dr. Kaufman, Dr. Perez are so awesome and share all those services. So we're so grateful, you know, Dr. Pozo to come on, all of your physicians to donate their time to just make sure that we can educate the community. So I really appreciate you coming on after your clinic today and sharing your story and educating us.
Well, it is my pleasure, actually, you know, and once this whole COVID is over, that we can do one of the other, you know, fundraising events, and we'll be happy to participate in whatever way you want us to do that, okay?
Awesome.
And again, I'm available whenever anybody needs any counseling or any reassurance. There's a light at the end of the tunnel. No matter, you know, how dark it looks right now, it's gonna be light. Trust me. Okay.
Thank you, Negi. Thank you so much for organizing all these amazing physicians for